In this video, we will going to explain a disease named Phenylketonuria. So, first, what is Phenylketonuria? Actually, Phenylketonuria is the most common congenital defect and disorder caused by inherited errors in amino acid metabolism. It's a result from a mutation in the phenylalanine hydroxylase gene. Some of you may be still unfamiliar and have never heard of this disease because Phenylketonuria is a very rare disease. It's happened fewer than 15,000 cases per year in Indonesia. And there are some symptoms that may appear because of Phenylketonuria. Some of them are tremors or shaking, seizures, rash on the skin or eczema, and bad breath, urine, skin, and hair. Phenylketonuria can vary from a very mild disease in blood phenylalanine concentration to become the classic severe phenotype with marked hyperphenylaninemia, which if left untreated, it will lead to severe and irreversible mental disability. Therefore, there are some developments that may appear in the patient with the Phenylketonuria, such as short stature, lack of enthusiasm, delayed development or slow growth, and cognitive like intellectual disabilities or slowness in activities.
Phenylketonuria or PKU occurs due to the high level of phenylalanine in the blood and the absence of phenylalanine hydroxylase enzyme. This enzyme used to convert phenylalanine into tyrosine, and because the low level of tyrosine in blood, it may cause some problem. For example, mental retardations or intellectual disability that leads to behavior problems, and then seizure, hypopigmentation, eczema, mousy odor, and also high level of phenylketones that found in urine. The prevention of PKU can be done with the newborn baby screening, where they go through blood tests to see their level of phenylalanine in their blood, and if they tend to have a PKU, the doctor can give initial treatment immediately to avoid them carry this disease. For treatment itself, patients or pregnant women with PKU, in order to avoid their baby inherited the same disease, they can go through low phenylalanine diet. In this diet, they have to avoid foods that contains high level of protein, because phenylalanine is derived from protein. The example of food that they have to avoid, as shown as this image, is like a meat, fish, dairy products, nuts, and also a food that contain aspartame, because aspartame will then convert into a phenylalanine in our body. Recommended food that they can take is like most of vegetable and fruit, and also low protein foods, and etc. Besides low phenylalanine diet, the patient also can have a drug treatment by taking medication called Kuvan or sapropterin. This drug is a covector classified drug and have a function for breaking down phenylalanine in the blood, but it's not really recommended because it has a lot of side effects, and not all patients with PKU are respond to this treatment, so it bears to the patient to just go through a low phenylalanine diet than taking this medicine.
For the disease management, phenylketonuria can be cured until now. The treatment of phenylketonuria aims to control the level of phenylalanine in the body so that it doesn't cause symptoms and to prevent complications. Treatment of phenylketonuria begins with adopting a diet that is low in phenylalanine. If left Untreated phenylketonuria can cause permanent brain damage. This condition can be characterized by several symptoms, such as inhibit growth and development of children, intellectual impairment or mental retardation. Phenylketonuria or PKU is a disease congenital caused by genetic disorder. Phenylketonuria sufferers do not be able to break down the amino acid phenylalanine, so this substance accumulates in the body.
First-line therapy for PKU is the low phenylalanine diet. This includes medical foods such as low or no phenylalanine medical formulas that are a synthetic form of protein, and foods modified to be low in protein. All high-protein foods such as meat, fish, eggs, and dairy are eliminated from the diet. Measured amount of some grains, vegetables, and fruits are allowed, depending on the individual patient's tolerance of small amounts of phenylalanine. Each patient will need to customize the amount of phenylalanine dietary intake with medical professionals according to their individual needs. In addition to the low phenylalanine diet, 2 FDA-approved pharmaceutical treatments are now available. Kuvan is a cofactor for phenylalanine hydroxylase, which helps improve the PKU patient's innate PAH enzyme activity and increase their phenylalanine tolerance. Kuvan must be used in conjunction with the low phenylalanine diet. Palynziq can be used in adults with PKU. Palynziq is an enzyme injected under the skin every day by the patient that circulates in the blood, metabolizing phenylalanine, and substitutes for the defective phenylalanine hydroxylase enzyme. Palynziq works well for many adult PKU patients, but it can have serious side effects in some patients.
The next is the relationship of phenylketonuria with biochemistry.
Phenylketonuria, or PKU, is a rare metabolic disease that can lead to severe brain disorders caused by the accumulation of the amino acid phenylalanine to toxic levels in the blood and brain. Amino acids are the basic building blocks that make up proteins. Phenylalanine, or Phe, is one of the essential amino acids. It's necessary for life, but our bodies can't make it. So, phenylalanine must be acquired through foods that contain protein. Normally, once phenylalanine enters the body, most of it is converted to tyrosine by the enzyme phenylalanine hydroxylase. Tyrosine is then turned into neurotransmitters important for normal brain development and function. PKU is an autosomal recessive genetic disorder that affects function of the phenylalanine hydroxylase enzyme. The phenylalanine hydroxylase gene is located on chromosome 12, and over 600 mutations have been described. The degree of enzyme function can vary. When untreated, people with PKU develop symptoms such as severe intellectual disability, psychiatric disorders, and seizures. A pregnant woman with PKU must pay special attention to her phenylalanine levels to reduce the risk of maternal PKU syndrome that can result in heart defects, microcephaly, and developmental disability in her baby. In PKU, elevated phenylalanine levels and reduced tyrosine levels can change the way the brain functions. This is because phenylalanine uses the same transporters to get across the blood-brain barrier as other amino acids, including tyrosine and tryptophan. Tyrosine is needed to synthesize dopamine and norepinephrine, and tryptophan is needed to synthesize the neurotransmitter serotonin. As phenylalanine levels rise, it occupies all transporters, making it hard for tyrosine and tryptophan to get across the blood-brain barrier. As a result, dopamine, norepinephrine, and serotonin levels in the brain begin to fall, leading to abnormal brain development and intellectual disability.